Hi, it's Chrissy, and today I wanted to talk to you about the symptoms of multiple myeloma. I'm doing a series of videos on multiple myeloma, partly because it's something that I'm dealing with, but also September is Blood Cancer Awareness Month, so I felt like this was a really good opportunity to bring more awareness around multiple myeloma. Now, keep in mind, I'm giving you a patient perspective. I'm not a doctor or a healthcare professional. So if you're feeling any symptoms or anything like that, please go get checked out by a healthcare professional. So as I stated in previous videos, but I'll say again, multiple myeloma is a blood cancer. It's a cancer of the plasma cells. And what happens is the plasma cells that are cancerous oftentimes crowd out the healthy cells that you need. So that can bring about a number of symptoms. But a lot of times those symptoms can mimic other conditions. So you'll see or hear a lot in the myeloma community about people who had to wait a long time to get diagnosed. For me, it took a year from the first time I felt symptoms to getting the initial diagnosis because it can mimic other things or seem like it's something else going on. Multiple myeloma affects the plasma cells, like I mentioned. It's a type of white blood cell, actually. So these are the white blood cells that are responsible for producing antibodies and are an integral part of the immune system. So one of the first symptoms that I want to mention is bone pain. I'm mentioning that first because that's the one that I dealt with. When I woke up to excruciating bone pain, it wasn't any kind of bone pain like you would think of, like maybe you slept the wrong way. This was sharp, excruciating pain. And what I found with talking with other people who have myeloma is sometimes they find out that they have myeloma when they actually break a bone or fracture a bone. So your bones can sometimes become really brittle as a symptom of myeloma. And that is, in some cases, people's first indication that anything is wrong. I talked to people who were at tip-top shape, running marathons, who got diagnosed with myeloma. So sometimes there isn't a clear indicator. I have talked to other people who it came up in their blood work where their physician saw something odd in their lab work, and that caused them to ultimately get a diagnosis. So it's very varied. Because it's varied and can mimic other things is why sometimes people get misdiagnosed or it takes a long time to get a diagnosis in the first place. Another symptom of myeloma is fatigue. So you could feel like really tired, and no matter how much rest you get, it's never enough. So sometimes you could be tired for like days on end and not be able to fully feel rested. So that's another symptom. And because a lot of things can cause you fatigue, it doesn't really give you a good indication of whether you have myeloma or not, but it is a symptom. Another less common symptom is frequent infections. Because those abnormal plasma cells crowd out healthy cells, it can make you more prone to getting infections over and over again. So sometimes if people are having a recurrent infection, it can then lead to ultimately getting a diagnosis of multiple myeloma. Another symptom that is very prominent are kidney problems, because the myeloma can affect your kidneys. So if you start to get persistent kidney issues, sometimes I have seen people talk about having to be on dialysis when they first get diagnosed. Then through treatment, their kidneys correct themselves, thankfully. But initially, you could have kidney problems at the beginning, and it's linked to the myeloma. And that's because the kidneys are trying to filter out all of the excess proteins, and it's having a hard time doing it. So it can cause kidney issues for some people. The other symptom of myeloma is anemia. It can cause you to be anemic. And in fact, for myself, I had issues with anemia for close to 9 or 10 years before I got diagnosed. So that's another indicator that something could be off. And another lesser known symptom of myeloma is hypercalcemia. So if you have elevated calcium that comes back and it's unknown, that can also link to myeloma as well. So I didn't make this video to scare you or cause any unnecessary fear. It's just to bring awareness around some of the common symptoms of multiple myeloma in case it may help someone. If you have symptoms, again, please consult a healthcare professional. I am not a healthcare professional. I'm just a patient offering a patient perspective. Another thing I want to mention is if you're related to someone who has multiple myeloma, there's something called the PROMISE study. The PROMISE study will evaluate you for myeloma if you are related to someone who has multiple myeloma. So that's a resource in case someone is interested in getting tested for multiple myeloma and you're related to somebody who has multiple myeloma. Just Google PROMISE study and you'll find out more information there. Multiple myeloma is a tricky diagnosis, and like I said, the symptoms can mimic many other things, but I just wanted to create this video to give an overview of some of the common symptoms in case it may help someone. I have other videos on my channel about how I got diagnosed, as well as my experience going through CAR T-cell therapy. If you're interested in viewing those videos, thank you for watching this video. Bye.